Dr. Zainab Bagudu is a pediatric surgeon, a pediatrician, and she runs her own facility that's called Medicaid. And over the years of practice as a pediatrician, she became interested in the area of pediatric cancer and then expanded into adult cancer advocacy. And she founded her own foundation that is called Medicaid Foundation. And she started this well before she became the wife of the governor of Kebbi State. So her interest goes beyond being the first lady of the state into a personal passion for this work that she's doing. She's going to present at the AACR meeting on Monday in order to showcase what her foundation has been doing. However, she is using her foundation in that presentation to be able to talk about the general work of NGOs operating in Nigeria. Nigeria representing a low and middle income country with low resources or mismanaged resources, as one would put it. She was able to show that mostly NGOs operate across the continuum of cancer care, from prevention, which includes primary prevention of vaccination, to education, informing people, the population, and arming them with the right information to inform their choice to increase the ability for them to make use of available early detection facilities that are in the country. One of the bane of cancer control in Nigeria in particular is the late detection. And that late detection is actually defined by stigmatization, fear of the fact that the perception that cancer is a death sentence. And that death sentence perception was defined by the fact that everybody they hear that had cancer dies. And why is that? The reason being that they are detected late. So late detection reduces your ability for survival. And so this information is being passed through education, rural outreaches to rural communities, and also urban communities as well, because no matter the level of education, that perception persists. And so the work of Her Excellency Zainab Bagudu actually spans beyond just Kebbi State into an effort in the Federal Capital Territory to reach the rest of the country. And she's doing this job in collaboration with so many international groups. And she's getting a lot of support as well from her husband, the governor of Kebbi State, His Excellency Bagudu. And with her profile, she's also able to muster a lot of political will because she has access to influencers, policymakers, community leaders, and with that access, she's able to reach more of the population. And over the years, I met her in 2009. She's been working consistently in this effort, impacting on prevention, education, early detection. That's actually getting involved in administering screening for cervical cancer, screening for breast cancer. She actually set up a diagnostic center in order to facilitate that process. So she's done a huge amount of work over the years. And in the recent past 2 years, she started getting involved in also reaching out to schools. So she has a school program to mentor young people to influence their perception of this illness, and to begin from that age group to get them to understand that prevention is part of the way to fight the cancer issue, and also to imbibe the vaccination efforts for cervical cancer reduction, and to ensure that they also become influencers for their families, being that they are in school. Some of their parents are not educated. So informing them, and children have a way of impacting older people whenever you arm them with information. Also in the past 1 year, she got involved in improving data ability for Nigeria to have better data records. And so she got involved in getting a cancer registry running in her state, and working with other stakeholders, the Federal Ministry of Health and other NGOs to empower on that. She's also been involved in international collaborations, and she's currently a board member of the Union for International Cancer Control, which she was elected into last year. And in that position, she is actually really sitting on an ability to be able to reach out to international collaborators to assist in looking back to Nigeria and seeing how they can assist us to better manage our cancer control measures. So in this presentation, she, being that is the American Association for Cancer Research, she wanted to, bring out the fact that over those years, she's been able to look back, and she sees that she has a lot of visual records of what she has done. However, does she have documented records that can translate into evidence-based data, and which can be published and which would inform policy decisions, create more impact, because with those policy decisions being informed by actual representation of what is happening in the country, then we'll make right policies and not waste scarce funding on policies that don't have impact, or policies that are not even, necessary. So more or less what we do is we look at what other developed countries are doing, and we think is one car fits all. There's no cultural content, inclusion of cultural content into some of the protocols that we adopt for cancer control in the country. So she began to appreciate more over the years that it was necessary for her to get into her foundation, to get into the area of cancer research advocacy, and see how she can also be an influencer in that area, both for government, influencing government policies, as well as education of healthcare providers to get more involved in research, and to also look at the aspect of patient involvement in cancer research. So because the practice now is exclusion of patients, except for the fact that you look at them as, they are participants. However, their involvement in cancer research should go beyond just being participants. And of course, their cooperation will be improved if you can get them to understand why cancer research is important. And this morning, I was actually listening to the opening ceremony, and one of the statements that was made by one of their awardees was the fact that for him, being able to keep patients alive long enough to benefit from new methods and new breakthroughs in cancer treatment is an advantage that we should all, take up. And I think that's something that, in my own experience, personal experience as a physician, being trained as a doctor, I found that our attitude in the when I'm 38 years in the medical field right now, so you can imagine how many years ago I'm talking about as a medical student. I found that once there's a cancer diagnosis, there's an attempt to discharge the patient and counsel them that the best thing is go and put your house in order. So it was really a death sentence then. And so I was curious to find out, is there no way we could improve on this? Thank God that we are now imbibing developments from outside of our country, and including palliative care and all that into the system, such that our effort now is to keep people comfortable, make sure that they have a good quality of life, whilst you await and hope that maybe before the illness overwhelms the patient, there might be a cure that might just come and save that person's life. I think that's makes us feel much better now about cancer care. So this would be more or less her message. And then, of course, her recommendations are that international collaborations are very, very welcome for us, both to improve our skills as healthcare providers, to improve what we are doing in terms of cancer advocacy, so that as we do that advocacy work, we should introduce an element of research into it to be able to, harness data from what we are doing that should be able to show measurable outcomes, impact, and be able to inform policy decisions going forward. And we feel that if we do that, the arena of cancer care in Nigeria would definitely improve. Those collaborations are important because you don't reinvent the wheel, and would like to benefit from already existing protocols for data storage, acquisition, even data retrieval and all that. We would like to do that. We would like to improve on our cancer registry records. We would like to participate more in the clinical trial process. Its clinical trial process, of course, introduces for us an ability for our patients to be involved in that clinical trial. And most times, it helps patients to benefit from drugs that they would not have been able to afford in the first instance. And then, of course, it improves on the health care infrastructure, and therefore raises the standard of care for cancer patients for us, as well as so many other things, including professional development for the providers that engage in this process. And then patient participation gives them hope in this research process. Understanding it introduces hope. Hope is one of the healing methods for cancer. If you can keep the hope of a cancer patient up, you may be able to improve, especially with the science of epigenetics. You should be able to improve their ability to survive that illness. Thank you.